Hello, team. So today's meeting, we're covering patient satisfaction with pain management in hospice. So my name is Ariel.
And my name is Samantha. These are today's topics of conversation. What is hospice? Our mission, NSI, leadership philosophy and theory, leadership style, management theory, interventions, and conclusion. Okay, team, what is hospice? Hospice is a program of comfort rather than aggressive care and support, services to meet unique needs of patients and families facing limited life expectancy.
Being a hospice nurse includes, but is not limited to, performing comprehensive nursing evaluations, assessing for signs and symptoms of discomfort, including presence of pain, and takes prompt and appropriate action. So we have a nursing sensitive indicator. According to the National Library of Medicine, approximately 40% of those at the end of life have severe unrelieved pain. Pain management of our patients have room for improvement, and during this PowerPoint, we will address how we can do better as a company. So our leadership philosophy ensures that we teach that care is tailored to each individual family. We want to teach our employees to support patients and family members during the transition and to reinforce death as a natural part of life. Family members often believe medicating the patients lead to an earlier death, so we want to educate on how it eases the natural process. We want to address psychological and spiritual pain as well, and make sure that we treat the family as one unit, as one patient. So patient care is provided to the loved ones as well. Post expiration, bereavement care is critical for loved ones, and we want to make all hospice, volunteer, and community resources available to the patient and the family.
Our leadership theory. Our leadership theory we chose was Brandt's. It's 1994. It's an interactive leadership model that suggests leaders develop a work environment that fosters autonomy and creativity through valuing and empowering followers. This leadership affirms the uniqueness of each individual in motivating them to contribute their unique talents to a common goal. Our leadership styles differ. So mine, Samantha, I'm a transformational leader, focuses on management tasks, committed, uses trade-offs to meet goals, examines causes, and uses contingency reward.
And I am a transactional leader. So basically, I identify common values. I'm more of a caretaker. I like to empower and inspire others with visions. I focus on the long term vision and I look at the effects.
Leadership style differences. According to Marcus and Houston, James McGregor Burns in 2003, he's a noted scholar, maintained that there are two primary types of leaders in management: transformational and transactional. These are the two types of leaders that Ariel and I are. The traditional manager concerned with the day to day operations was termed the transactional leader. And the manager who is committed, has a vision, and is able to empower others with this vision is the transformational leader. Management theory and interventions. Chris Argyris developed theory in 1964 in the employee participation. He stressed the need for flexibility within the organization and employee participation in decision making. Our interventions as a team. We will have IDG meetings and all staff meetings to train on page management, as well as RN team driven team meetings. And we want to prevent on round the clock pain med administration to family and patients. And we want to have follow up calls. Let the family and patients know they can call us within an hour or so, or we want to follow up with them after a visit for the evaluation on their pain.
So hospice care is all encompassing. We want to make sure that we accomplish complete comprehensive assessments, including psychosocial, bereavement, spiritual, medical, nutritional, and mental needs of the patient and family. We want to make sure we involve the family in the plan of care, provide schedules, keep them up to date, educate on expected biological and psychological changes of their loved one.
Here at hospice, we rely on communication, education of family, and medication to manage pain. However, our patients and family members are reporting higher pain levels. Ways to implement changes: motivate, inspire, direct, infrastructure. In the next few slides, we will discuss ways to implement the necessary changes to decrease pain levels of our patients.
Okay, so our case managers are the faces of our organization. They work hard and are reliable. However, we as a company still have room for improvement. It is important that we empower our case managers to be proactive and not reactive, and that we know, the best way to manage pain is to prevent it. So we need to ensure that our case managers knows how to anticipate pain. We want to ensure that you guys, as case managers, are flexible with screening for other non pharmacological and pharmacological ways to manage pain. That is a skill that we want our case managers to acquire and enhance. And we want for you guys to be realistic with the family and educate family members on the necessity of what they may view as aggressive pain management. And as always, we want to be organized and have good communication skills, and all of that will improve patients' pain.
So we want to provide the family with a schedule. Caregiver role strain causes psychological pain. Providing family with a schedule of when to expect our visits or calls from chaplains, social workers, and nurses will promote a sense of control and organization. Having a hard copy with reminders of when to turn and when to administer medication and when to anticipate medication refills will help manage caregiver role strain and patient level of pain. Okay, here's our comfort kit. With hospice, we have a standard comfort kit for all patients. That's not to include the patients that have allergies to some of these medications that will be tailored to them. But as a team, we must educate on morphine use for pain management. Some family members are hesitant to give morphine because they feel as if the patient may become addicted, or they may kill their loved one, or they're scared to administer an overdose. We must educate that it is to comfort their pain and they have a terminal disease. Addiction is not an issue that we are concerned about in this short amount of lifespan. We also can offer Narcan as an antidote if they are afraid of the overdose.
Unexpected incidences, they occur at any time of the day. Patients and family members they've expressed their frustration with using our outsourced telehealth company. There was a lack of consistency due to encountering different nurses who were unfamiliar with their concerns, and as a result, their needs went unmet. So we've now hired one telehealth nurse that will take all after-hour calls and ensure emergencies and pain complications are handled properly.
There have been instances when the MDs were not on call and could not access their medical records to make certain changes. Therefore, we are implementing encrypted infrastructure for MDs to access our EHR and modify prescriptions from their personal cell phones. Bereavement. Pain does not end with death. Spiritual pain lingers as family members may have complicated or normal levels of grieving. It is important to follow up post-patient expiration to help maintain a healthy level of grieving.
So we have been slowly implementing some of these changes. So we just want to take a chance to evaluate our changes that we've made. And one of the best ways that we can evaluate is using graphic images. It helps to visualize the outcomes. Here we can see that as communication with the patient and family increased, the anxiety and pain level decreased. We treated communication as an umbrella term, and it encompasses communication and education of the patient and family members, as well as communication with providers and their ability to communicate back using the EHR infrastructure on their phones. Thanks.
Thank you guys very much. And remember, we have an open door policy here at Mission Hospice. If our doors are open, you're welcome to come in and talk with us. And of course, we're just a phone call or email away. Here are some of our references. Thank you very much.